Coronavirus lockdown in Greater Brisbane will end this evening after Queensland recorded no new local cases overnight. Here's reporter Michael Rennie in Brisbane.
People in Queensland and in Brisbane, the 2 million people that live in Brisbane and the Greater Brisbane area, because that lockdown, it was harsh over the weekend, and certainly people's movements was restricted, and the face mask, that was something that people were getting used to, and just the harsh lockdown overall was very harsh on business as well, and particularly businesses here in the Queen Street Mall, which have already been suffering significantly because of the COVID and because of the COVID outbreak. But really good news to hear that we will have some easing of the restrictions, although masks will still need to be worn for the next 10 days at indoor venues and some cases outdoor as well. Of course, this all stems after a quarantine cleaner, a hotel quarantine worker, tested positive to the UK strain of the coronavirus and was in the community for 5 days. And 70% more infectious, that strain of the disease. So look, the authorities here not taking any chances with this, even though we've had 0 cases over the weekend, and they're hoping the 0 cases, locally acquired cases, will continue, that we won't see any locally acquired cases pop up. But they still have concerns that some people need to come forward. A lot of contact tracing already done, but they'd like to see a little bit more. Like to see more people come forward if you do think you were in one of those areas where this woman had been, and all those details are on the Queensland Government website. But the police overall say that over the weekend people were very compliant overall, and were wearing the masks, were doing the right thing, were not leaving their neighbourhoods, and so good to see that. And I think they'll be hoping that people continue that over the next 10 days, and then things can basically get back to normal, Ros, as they were before. Queensland was enjoying some of the lowest restrictions anywhere in the country.
Definitely not an overreaction. It was absolutely supported by AHPPC. It was supported by National Cabinet, and as you have seen, it has been supported by people in Greater Brisbane. They have absolutely done everything that we have asked them, and they have seen the results today.
Some restrictions, though, will remain in place, as you said, Michael. Is it just masks that are staying?
Oh no, there's some other ones coming in as well. Look, just on the masks, I'll take you through some of the rules that have been put in place. So masks must be worn in indoor places, including shopping centres and workplaces where you cannot socially distance. They must be carried with you at all times, and are not required to be worn when outdoors at a safe distance. Now, at pubs and clubs as well, you don't need to wear a mask while you're indoors if you're drinking or eating. So that's a bit of a difference in the rules there. With businesses and venues, 1 person per 4 square metres. For outdoors, it's 1 person per 2 square metres. And seated eating and drinking only. So we're going back to that as well. In terms of gatherings, you can have up to 20 people in homes and in public spaces. Weddings up to 100, and there's no restrictions on dancing, and funerals up to 100 as well. And you can, of course, get all the detail, more detail of that on the Queensland Government website. So I think mostly people in Brisbane are used to these rules already. I think the one everyone's going to have to get used to is wearing the mask.
All right, Michael in Brisbane, thank you. The Northern Territory Government has revoked its hotspot declaration for Greater Brisbane. People arriving from the Brisbane, Ipswich, Logan, Moreton Bay and Redland local council areas will no longer have to undergo mandatory quarantine upon arrival. Staying in the Territory, and Darwin's Howard Springs quarantine facility will soon accept 850 international arrivals a fortnight under a new agreement between the federal and the NT governments. Reporter Nicholas Hines has more.
The Northern Territory Government announced that it's revoked the coronavirus hotspot declaration for Greater Brisbane, which means anyone here at the Howard Springs quarantine facility who's travelled from Brisbane over the weekend will now be free to leave and enter the Northern Territory. That hotspot declaration was made on Friday after the positive case of the UK strain of coronavirus was detected in Brisbane, prompting the lockdown over the weekend.
And Nick, on Friday, the federal government announced it would halve the number of international arrivals coming into New South Wales, Queensland and Western Australia. Why is the NT able to accept more arrivals?
Yes, Ros, the Northern Territory is in a bit of a unique position here at Howard Springs. We have a large isolated facility where we're able to quarantine people on the outskirts of Darwin. And that means that while states such as New South Wales, Queensland and Western Australia have slashed their international arrivals numbers due to the concerns around the UK strain of coronavirus, the Northern Territory health authorities are confident that they're able to continue safely managing the quarantine program here. So the federal government announced yesterday there is a new agreement between the federal and NT governments, which will see an extra 250 arrivals each fortnight here at Howard Springs.
And that facility there is used to quarantine both international and domestic arrivals. How's that managed?
Yeah, there is some community concern about the potential for spread here because essentially the Howard Springs quarantine facility is split in half. Any domestic travellers caught out by interstate lockdowns or hotspots, such as those from Brisbane over the weekend, are kept on a domestic side, which is managed by the Northern Territory government, while those repatriated Australians coming here through the federal government's program are managed by the National Critical Care and Trauma Response Centre. Now, it's unclear just how they will ensure this increased capacity doesn't affect the overall logistical management of the facility. But the federal government did say that they've taken that into consideration in making this expansion, as well as mitigating for other potential emergencies. Of course, here in the top end, there is a chance we could see a cyclone over the next few months. The federal government says all of that has been taken into account here.
Nick, thanks. 3 new community cases of COVID-19 have been reported in New South Wales today, and a patient who presented to a hospital west of Sydney after the reporting period has also tested positive. State Political reporter Ashley Raper has more.
A man in his 40s went to the emergency department at the Mount Druitt Hospital late on Saturday night. Now, he had symptoms of COVID-19 and he was tested, and that test has come back positive. And then his wife, who was at home, she wasn't at the ED, she has also been found to have the virus. Now, this situation is causing a concern for 2 reasons. First, that this man sat in the emergency department for quite some time before he was seen. So there is concern about potential exposure in the emergency department. The authorities have shut the emergency department in Mount Druitt for deep cleaning, and I believe it's about to reopen or has reopened in the past hour or half an hour. Now, the second reason that this is causing concern is that they don't know how this pair contracted the virus. At this stage, they can't link it to the Baralla cluster in Western Sydney or any so far. So there's a lot of contact tracing going on right now. The pair are being interviewed, and they're also looking at the potential exposure at the emergency department. So a lot of work at the moment is being done around these 2 cases in Mount Druitt.
So take us through the detail of today's numbers, Ashley.
Yes, these 2 cases in Mount Druitt aren't actually included in the official numbers. So officially we have 3 new cases of coronavirus in New South Wales, and the 3 are linked to the Baralla cluster, which originated in the bottle shop there in that suburb in Western Sydney. Now, the 3 cases, they're all members of the same family, a man, a woman and a child, and they believe that they caught the virus having dinner with another couple who were cases that were revealed yesterday. So it's good news that obviously that the cases today are linked to the Baralla cluster, but in bad news, look, that there is a transmission still occurring in the community, and the Premier Gladys Berejiklian has just reminded the community that we still need to be vigilant and still follow the quite tight restrictions here in Greater Sydney at this point in time.
I appreciate very much the critical phase of the pandemic we're in. New South Wales, under the circumstances, is doing relatively well, but we are in the phase of mopping up. We are in the phase of really trying to identify any community transmission that hasn't been previously detected, to make sure that any chains which exist in the community, which we hadn't picked up before, have been and are being picked up.
There were 18,000 tests done in New South Wales over the past 24 hours. Authorities are not happy with those numbers. They need them to be at least 25,000, 30,000 a day. So the government is again making an appeal to people to come home and testing at what they're saying is a critical, pivotal time to try and mop up and ensure that we, strive here in New South Wales for no community transmissions, Ros.
Ashley, thank you. Victoria has recorded another day with no new locally acquired coronavirus cases, and it comes as the state government considers whether to reopen its border with New South Wales. Reporter Beth Gibson has the details.
It's another positive day in Victoria with the Department of Health reporting 0 new locally acquired cases, and that's the 5th day in a row that Victoria's had no new cases. There's 1 case in hotel quarantine, and with a total number of 40 active cases in the state. But we do know that there are still thousands of Victorians stuck in New South Wales and in Queensland due to those 2 border closures. The Victorian government has flagged that they are likely to provide an update on those border closures later today. So there are many Victorians pretty eager to hear when they'll be able to come home from those 2 states.
We understand, Beth, that the New South Wales Premier has taken another swipe at the Victorian government over the border closure.
That's right. So it's a bit of an ongoing tit for tat. So yesterday, Gladys Berejiklian effectively accused the Victorian government of failing to let her know before making that decision to close the border. Victorian government came back saying that he was having daily phone calls with his New South Wales counterpart. And then this morning, Gladys has said that yes, there are daily phone calls, but she would have liked some input into that decision. And she made broader statements that all states should be doing better with communication around borders because they are decisions that impact thousands and thousands of people's lives.
Beth, thank you. WA's border with Queensland will remain closed for now, with Premier Mark McGowan saying his state will be cautious in its decision-making. Here's reporter Jacob Kagi in Perth.
WA is staying shut to Queensland, and it's likely to do so for a little while yet. The Premier says that until Queensland authorities are absolutely certain that there's no spread of the virus with the community, within that community, WA will be staying shut to Queensland. Now, in the past, the threshold has been for WA to reopen a closed border has been 28 days of no community spread in that particular state. There is some openness on WA's behalf, though, to open before that threshold, given there's only been 1 confirmed case in Queensland. That will still be a little way away, though. The Premier says that with restrictions continuing in some form in Brisbane for the next 10 days or so, that he would think it's quite unlikely that WA would reopen to Queensland within that time.
In terms of Western Australia's approach to Queensland, we'll get health advice on what the appropriate course is. I do note that Brisbane is going to go through a further 10 days of restrictions, mask wearing, 4 square metre rule, restrictions on the number of people attending sporting events and the like. So I wouldn't expect we'd take any action before Queensland is sure they don't have community spread of the virus. But at the end of that point in time, we'll get further health advice.
Jacob, what about other states that WA is closed to?
Well, WA is currently still closed to New South Wales and Victoria. For New South Wales, that will continue indefinitely. That 28-day threshold of no cases is likely to apply, and of course there are still cases being picked up in the New South Wales community, so at the very least WA is 4 weeks away from reopening to New South Wales, likely longer. In the case of Victoria, they've now had a few days in a row of no cases. The Premier says that it'll take likely a bit more than 4 weeks of 0 cases in that period for WA to consider reopening to them.
Thanks, Jacob.